if you enhance somebody's beauty, you do a lot for them emotionally. And I felt that whether it's just removing hair or Botox or fixing a droopy eyelid, all these things become very gratifying. I traveled all over the world treating little children with eyelid deformities. And it was just very, very gratifying. So if you can satisfy the patient and make sure that you put financial incentives aside, because I don't know the price of anything. Because I focus on the patient. What's the patient need? That comes first. And that was my philosophy. That was my core philosophy. How do I improve? How do I make somebody feel good? So I graduated with honors, medical school. And at the time in medical school, you only had the top 1% of students. And I graduated with honors because I was very passionate about the field of medicine, but more so towards the surgical end. When I worked in the emergency room, I enjoyed reconstructing people that were in traumatic accidents. And with my anatomy background and what I enjoyed doing, I wanted to go into reconstruction and then cosmetics. When I first came out, I went to a special school in New York to learn plastic surgery of the eyelids, and then I taught at the Cook County. I received numerous awards for teaching there, and then from there it became more and more cosmetics. As the environment of medicine started changing, where it became more socialized and more government controlled, I wanted the freedom of expression, and that's what cosmetics brought to me. Where I could learn as much as possible and become as best as possible, and also receive the satisfaction of that and not being controlled by a bureaucrat. I always looked for people that cared about the patient. So you look for certain skills, of course, dexterity, caring, personality. I think that if you can get all that in one person, you have a winning team. And that's what I looked for. That was my philosophy. Doesn't mean that we hired a group of people and then we just kept them. No, because we had to turn over a few until we found the right person, or we put that right person in the right position. Some of my help have been here since the beginning. So we kept the best people. And I think that if you're kind to them and you're humble, because I feel like you can't be arrogant. You can't come in and start screaming at people. You have to be humble and understand that this is a team effort. I ride more on their coattails than anything. But I think I have the vision, and they appreciate that, where things are going. My biggest accomplishment in the center, I feel, putting aside the space, because you had to have the space in order for people to work, a large enough space. We have 16,000 square feet, and an operating room. That's the structure. But inside the structure, you need the people. My biggest accomplishment, with the help of Dawn Davidson and Grizel, was finding the right people to fill the space. That was the biggest accomplishment. And then empowering those people, because Grizel is phenomenal at finding people. Dawn is phenomenal at patient care, and empowering them to do the best that they can. And then things just start to happen naturally.
My name is Leonard Liu. I'm a board-certified plastic surgeon. I've been practicing here for approximately 6 to 7 years. Well, you can say that medicine was in my blood. I have a father who was a family practitioner, and my older brother is also a physician. So the cliche is that you go into medicine to help people, and I think that definitely applies for me. But specifically, why I went to plastic surgery is really the breadth of the surgeries that we do. It's really nice to be able to perform a surgery and see the visual results, but also to help the function and a lot of times the inside of the patient, meaning their self-image and the way they feel about themselves. I really enjoy listening to the patient's concerns and really formulating a plan, whether it's surgical or non-surgical. and then executing that plan and hopefully exceeding the patient's expectation and seeing them progress throughout the process. I think there's multiple misconceptions. One of the things I hear from patients and questions I get all the time is that everything that we do is scarless. And although we try to hide scars or make them inconspicuous or let them heal really well, a lot of what we do when you make an incision on the skin is going to result in a scar. But again, our goal is to make it in either an inconspicuous location or very well healed so it's not very noticeable. A couple other misconceptions that we get all the time is that plastic surgery is only for the vain and the rich. I think more than ever, plastic surgery can be affordable, and a lot of patients think that, gosh, I'm performing surgery or getting surgery, and that means that I'm overly vain. I don't think that's true, especially these days. Another common misconception is that only women do plastic surgery. More and more men are pursuing either non-surgical or surgical techniques in order to sort of improve their appearance. And another misconception is that all cosmetic surgeons are plastic surgeons. It's definitely a buyer beware market. I would definitely recommend consulting with a board-certified plastic surgeon, which means that you've gone through the prerequisite education and training and also the testing to become a board-certified plastic surgeon. You can advertise as a cosmetic surgeon, but that doesn't mean you're a plastic surgeon. There's a lot of really memorable cases, but probably one that would stand out in my head is operating on a child. I think she was 6 years old, a girl who was just school age, and she had very prominent ears. And she'd been teased really from early on. And we did an otoplasty, and otherwise known as an ear pinning. And I remember the first time I met her, she would have her hair down, very shy girl. And by 3 months after the surgery, the mother had reported, with the girl coming in with a ponytail, that she had just really blossomed into this really outgoing girl. And I know that really I've probably have hopefully changed this girl's life for the better for the rest of her years coming forward. Surgery can be a very daunting and scary task for a lot of patients. And my job is to listen to the patient and to perform very safe surgery. And I always tell patients that I'm there for them throughout the whole process, even before and certainly during, but after the surgery as well. We'll definitely follow through until we reach the patient or exceeds their expectations.
One of the things that I'm very passionate about is we have to be very honest with the patient. Integrity. We have a reputation that goes back over 20 years. That we're not going to just take advantage of anybody or recommend certain things that they don't need. I won't do something if I don't think they need it. I'll refuse. And I want the patient to know that if they come to me, for instance, for a tattoo removal, I'm going to remove it as fast as I can with the best technology at the best competitive price, period.